Hello, my name is Paula and I'm here to talk to you about the pre-IVF care of our patients, the nurse as the couples advocate. Nurses are recognised as the health professional that will spend the most time with patients. The American Nurse Association, the ANA, describes nursing as the glue that holds the patient's health care journey together, a science and an art. Meeting the many challenges inherent to providing safe, quality, patient-centred care takes both scientific knowledge and creative art. To be effective, nurses need to exhibit knowledge, technical skills and communication capabilities. To achieve these aspects, the nurse needs to maintain their professional development and to be interested in new developments and treatments. This is especially important for ART. Our patients are not usually unwell. They're usually young and not really ready to not reach their goals. It does put extra challenges, and because they are customers as well, they have different expectations to a patient that's in hospital, although we all have expectations of our care. The nurse needs to continue to invest in knowledge and education and thereby supporting current and cutting-edge treatments the medical specialist or the embryologist discusses with the patient. This is to enhance their treatment outcomes. Nurses are the patient's link between themselves and other supporting teams, the medical, embryology and administration, during the most difficult times for a couple's life together. Nurses can foster collaborative working relationships, exchanging ideas for patient cares, sharing information and communicating, and thereby creating an environment where there's no conflicting information for the patient to experience and that a uniformity of care is delivered. A team approach provides patient experiences and care that are seamless. The patient needs to be seen and heard, to know that they are in safe hands. This supports the patient's confidence and helps to keep going, which in turn increases the likeliness of success. A patient that continues in care is more likely to achieve their goal. The nurse in ART needs the ability to develop and maintain collaborative, supportive relationships with their patients. Making time for patients, listening, having sympathy, empathy, and conveying a sense of commitment all play a role in meeting the patient's expectations. Our patients rarely are a one visit, one cycle, and pregnant and be gone. They are in our care for some time. A working relationship with our patients will help them to keep going with treatment, and we recognise that we are with them throughout. Treatment for infertility has the potential to take time to achieve the longed-for outcome of a live birth, and it isn't always successful to reach that goal. Although nurses are unable to change the outcome of IVF treatment, there is evidence that nurses can make a positive impact on the lives of couples while pursuing IVF. The priority for patients' education is relevance to their treatment and their needs, explained in a manner that provides the education they need. Check in with a couple and ensure that they're comfortable with the way they're receiving your information. This will help them to engage in their care. Supportive discussion allows the couple to provide informed consent and to set realistic expectations. Although difficult, this can help to buffer them when their treatment cycle isn't successful. The ANZAR 2019 report, which provides information about ART treatment and resulting pregnancy and birth outcomes in Australia and New Zealand, showed the overall clinical pregnancy rate for cycles reaching embryo transfer was 35.4%. That includes fresh and frozen transfer. This information doesn't need to be provided to patients, although it is on the public record, but understanding and supporting the patients to take time to conceive is useful. Using this knowledge, the nursing team provides information and education prior to commencing their IVF cycle for the first time. The nurse will explain that IVF is a method of assisted reproduction in which a man's sperm and a woman's eggs are combined outside of the body in a laboratory dish. One or more fertilised eggs, embryos, may be transferred into the woman's uterus, where they may implant into the uterine lining and develop. The aim of this treatment is to increase the chances of a successful pregnancy through the technology of IVF by controlling the body systems with medications and enhancing the biological processes in the laboratory. Serious complications from the medications used during the treatment cycle or the procedures required are rare. However, with all medical treatments, there are some potential negative effects or outcomes. Discussing these positive negative effects and providing management strategies will provide reassurance and confidence to the couple. At times, women experience pain, bruising, tenderness at the injection sites. This can be reduced by choosing different sites daily and to consider a small ice pack prior and following the injection administration. This will help to reduce any discomfort and minimise bruising. Some may notice a local mild allergic reaction, which may include skin itching or redness. This can also be minimised by the application of a small ice pack. And just reassure the patient that it will be a short-term effect. Breast tenderness, similar to the sensitivity some women experience before or during their menses, are not uncommon. Fatigue is most commonly experienced as most are already busy and now have the additional hormonal burden of an IVF cycle. Sometimes irritability, restlessness and anxiety from the additional hormones, but can also be expected from the emotional drain felt by both partners once treatment has started. We encourage our patients to recognise their feelings and to take action with counselling, acupuncture, yoga. Maintaining exercise program is beneficial both physically and mentally for their mental health. Suggest food for mood when choosing your food choices during this time. Nurses explain that normally a woman's ovary will release one mature egg per cycle and the other small follicles with immature eggs will fail to grow and be lost. During an IVF cycle, we use artificial versions of the hormones to stimulate the ovary, encouraging the growth of multiple follicles with the aim to collect a greater number of mature eggs. We reassure the couple that this will not diminish their ovarian reserve of eggs. More eggs will mean more opportunity to find the right embryo. The couple are provided with dates and events to allow an understanding of the IVF cycle timeline, and this is discussed with our couple during education on what to expect. Other medications will hold the egg in the ovary until the trigger injection, will time release of the eggs from the follicle to allow collection by the surgeon. The nurse provides education and supporting materials to allow the patient to manage their injection administration at home. This allows the patient to exert some control over the administration and reduce the burden of care by minimising time that will be required to travel to the IVF nurses. IVF is an amazing technology, and although the treatment cycle for most is very manageable, it is a difficult period of our patients' lives. To recognise this for both the patients and the nurses acknowledges that additional support is useful during this time. Nurses discuss with the couple the physical, emotional and financial burden for those experiencing infertility, in addition to an IVF cycle. We can encourage and provide supports such as counselling, which in Australia is provided to the patient by an ANZICA member counsellor for support during their IVF cycle and included in the IVF cycle costs. During this education, we encourage the couple to action lifestyle changes that may be beneficial to assist in reducing the time to pregnancy. These include ideally stopping or at least reducing smoking, as it is such a difficult habit to let go of, alcohol, reducing sugars and fats in the couple's diet, and increasing daily exercise if not achieving at least 30 minutes a day. Information can be sourced from those websites, which are up to date and provide a great resource for patients. And for men specifically, the healthy male. Sperm health is equally important to achieve a healthy pregnancy. And as time is required to improve sperm factors, providing this information prior to starting IVF will provide the most benefit. Ultrasound monitoring will be required to assess response to the daily injections. The nurse explains that the ultrasound technique usually involves And I say usually because, of course, some people may need an abdominal ultrasound. Gently placing the ultrasound probe in the vagina to allow reporting of the follicular sizes and the endometrial thickness. This procedure is normally painless and only takes minutes. The ultrasound will allow the couple also to visualise the follicular growth, which can be a time of anxiety or excitement depending on the patient's expectations. The ovarian response can be a source of concern for some. Taking time to prepare the patient and to provide supports and understanding can be beneficial. Patients often want to know how many eggs you think they're going to get, and that can be a bit of a balancing act. Not to be too over generous with your numbers and not to deflate their enthusiasm for going ahead. During education, the importance of the trigger injection and timing of administration is explained. Once the couple understand that the trigger helps to mature the eggs and allow aspiration from the follicle at egg collection, the correct timing can be assured, as the couple are now aware of its importance to optimise collection of a mature egg from the follicle during the retrieval process. Unwelcome outcomes of ovarian stimulation are possible. At times the ovary does not respond as expected, and the first cycle is always a trial. Although the doctor has taken all known response to prescribe the medication dose, we as humans do not always respond to medications in the expected way. This woman may not respond as expected, with less follicles, potential eggs, or maybe over-respond. We discuss with the patient what these findings may mean to them. Unexpected under-response may encourage the couple to cancel the first cycle and return with a higher dose next time, once the woman's response to medication is now known. Over-response can be managed by considering, if appropriate, changing the trigger injection to an agonist, planning freezing of all embryos, returning to transferring at a frozen embryo method, and of course other methods prescribed by the treating doctor can be discussed. The concern with over-response is the possibility of ovarian hyperstimulation resulting in a hospital admission. When the increased follicle numbers following the trigger injection cause the body to respond by enlarging the ovaries and allowing fluid to leak into the pelvis. Most symptoms of ovarian stimulation, nausea, bloating, abdominal discomfort and pain, are mild. They are usually self-limiting and will resolve with minimal treatments such as rest, pain relief, within 5 to 7 days of egg collection. In severe cases though, OHSS can cause large amounts of fluids to build up in the abdomen and leak into the lungs, causing painfully enlarged ovaries, fluid imbalance, trouble breathing, and severe bloating and abdominal pain due to this fluid collection. Very rarely, in less than 1% of women in Australia having an egg retrieval, OHSS, ovarian hyperstimulation syndrome, is serious and requires extended hospitalisation. To reassure the couple, there are many measures to avoid this outcome. The nurse discusses fasting requirements and admission for the egg collection procedure, which follows the trigger injection, usually 36 hours later. Dependent on the individual IVF unit care policy, our patient may admit to a day surgery or to a hospital service. We explain the identity confirmation process so that the woman is prepared and both understand the procedures that are in place to mitigate any risk when labelling gametes, of course, and that will happen exactly the same with the semen sample. The couple can expect discharge 3 to 4 hours from admission. The man will provide the semen sample the same day as the egg collection. The nurse will explain the benefits to the sample of abstinence of 2 to 5 days and discuss appointment timing and where to present. This can at times cause anxiety for the man, and at the education session this is a good opportunity just to ensure that he's not having any concerns for this appointment. If yes, a discussion and strategies to manage can be in place prior to the day. It's much better to be organised than finding out when the man can't produce the sample. Embryology terms are discussed, and these are often the most magical. Eggs, sperm and embryos are not usually visualised nor discussed. Having images of gametes and subsequent embryos can provide a platform for understanding the terminology. Not that they'll remember, but it is great to be able to see what things are going to look like and embryos and development, just so that the patient has an understanding of what they may experience when speaking with the embryology team. The couple advise what to expect following the egg collection and when to expect updates from the embryology team. The nurse can acknowledge that for most couples waiting for an update about their embryos, they can feel additional anxiety. To put some time together in place or to agree to have some relaxation time may help. The nurse will follow up, usually with the woman rather than the man, to confirm ongoing recovery following the egg collection procedure, and then to confirm prescribed medications following retrieval to support the embryo transfer, and possible side effects are discussed and the transfer planning confirmed. Of course, if they had to cancel planning for a transfer, then that plan forward will be discussed. The couple will be provided with information regarding the embryo transfer to allow expectations of what to expect. The woman can expect that placing the embryo into the uterus using a thin plastic tube called a transfer catheter will take about 6 to 10 minutes and not expected to be uncomfortable. The doctor inserts the speculum into the vagina and locates the cervix. An abdominal ultrasound may be used to visualise the uterine cavity. This will guide placing the embryo high into the cavity. The embryologist uses a pipette to pick the embryo and place it and pass it to the doctor. The catheter is passed through the cervix into the uterus. Following the transfer, the embryologist will confirm that the embryo has not remained in the catheter, and then the patient will be able to get and resume her daily activities. To assist in an easier embryo transfer, the woman is asked to have a semi-full bladder and to allow a view of the uterus with the ultrasound. Vitrification, which is the freezing of remaining good quality embryos, may be possible and will be discussed with the embryologist. The medication schedule is discussed again following the transfer and pregnancy test provided. The waiting for pregnancy test date and then the result for many couples is most difficult. There's quite a lot of discussion about the 2-week wait, and we discuss this with our couple. We discuss supports that the nurses offer and external supports other patients have found to be beneficial. They may include acupuncture, counselling. The nurses will call and to reach out to us with any questions or concerns. The pharma company Merck provides a supportive post on the 2-week wait, and here is the podcast link. The pregnancy test, what will happen? This measures the hormone human chorionic gonadotrophin, the HCG, which is produced by the early pregnancy. The woman may experience a small amount of spotting or feel as though she's getting a period at this time. We will encourage the couple to continue the prescribed medications and present for the blood test. Early pregnancy and getting your period feel very, very similar. If the test is positive, we advise the couple on medications and what to expect with early pregnancy. We would confirm all preconception supplements are continued. We discuss monitoring of the early pregnancy through blood testing. We will provide information regarding medication that's safe in pregnancy and provide safe eating choices and management of any unwanted negative effects of early pregnancy. An ultrasound to confirm viability will be scheduled usually 3 to 4 weeks following the first pregnancy test. We discuss with the couple that although a joyous time, there can be anxiety, always hoping everything will be proceeding as hoped and terrified that it won't. It may be that the embryo transfer was not able to grow into a pregnancy and the blood test was negative. Some more support medications are now stopped and the nurse will prepare the woman to expect a period. We recognise the grief of not being pregnant this time and talk about supporting them both. To achieve a pregnancy will often take more than one transfer, and we encourage the couple to keep their review with their doctor. We encourage our couple to seek counselling if they found this supportive and to talk with the nurses if they found this helpful. Thank you for your attention. It's not easy to talk about all the things that we might be able to support our patients, but I do hope that just having an idea that we can support our patients and make a difference in their lives was worthwhile. I thank you again.
Hello everyone, my name is Flory. I'm the nursing officer of Union Reproductive Medicine Center of Hong Kong Union Hospital. Today I'm going to talk about the role of an IVF nurse during an IVF cycle and the key in patient interaction support. In my presentation, I will introduce the nature of IVF nurse, their daily duties on pre-IVF preparation, when the treatment begins, during egg retrieval and embryo transfer, and also arrangement of pregnancy tests. I will also introduce their role on education, communication, risk discussion, psychological and medical legal aspect. Finally, I will talk about how to become a successful IVF nurse. IVF nurse is also known as infertility nurse or reproductive nurse. They are nurses who care for individuals, couples, and families in areas that concern reproductive health and fertility. In the early days of IVF, IVF nurses' role was similar to traditional nursing. Early in 1980s, IVF nurse was considered as doctor's handmaiden in hospital-based infertility clinic. Later in 1990s, IVF clinic appeared within hospitals, and IVF nurse became coordinator. After the increasing requirement for infertility treatment, demand of IVF nursing resources increased. Nowadays, private IVF clinics are expanding, and IVF nurses start extending their role and scope of practice with higher autonomy. Most IVF nurses work in hospitals, fertility clinics, donation centers, and research and academic institutions. IVF nurses are expected to be involved in all kinds of aspects. They work with couples who are trying to conceive or experiencing difficulties to conceive, and also women going through menopause. They are responsible for providing holistic approach to investigations, treatments, and early pregnancy through compassionate, informed, and evidence-based practice. They are also engaged with multi-professional teams like doctors, embryologists, psychological counselors, and even dietitians and endocrinologists. IVF nurse works on assisting patients in a non-judgmental way throughout the infertility treatment process. They offer emotional support to patients, counseling couples and donors. They also provide patient education, participate in and coordinate team meetings. They also perform theater work and procedures. Some IVF nurses also lead infertility support groups and work with researchers in development of reproductive technologies. In the following of my sharing, I will focus on the role of an IVF nurse in all stages of the IVF treatment cycle and the skills an IVF nurse should have. Before starting the IVF cycle, IVF nurses help patients to have a series of preparations. The first step is to arrange patient with an appointment consultation together with the fertility specialist. After the couple consulted with their doctor, IVF nurses ensure they receive adequate and sufficient information regarding their upcoming investigation and treatments. They evaluate if patients' individualized care needs are fulfilled. They monitor if patients understand what has been discussed and know the process ahead. IVF nurses also participating in planning of patient-based treatment cycle in collaboration with fertility specialists to ensure the selected treatment is the best one for helping patients to get pregnant. They provide information counseling, which help patients understand each step from the beginning till the end of the IVF journey. IVF nurses allow patients to ask whatever they want to know or not understand. Another important task is to get the couple complete and sign all the necessary consent forms before the treatment starts. Within the information counseling, IVF nurses have to explain the time schedule to the patients. telling them how many times they need to come for ultrasound scanning and blood tests, how long they need to stay in clinic in every visit, duration of egg collection operation, and the length of stay after the operation. IVF nurse will also mention the financial budget, as in the field of IVF, most patients are self-funded. They may want to know the estimated cost they are going to pay. They also need to discuss with patient any potential risk related to IVF, including those related to medication and operation. IVF nurses also carry out phlebotomy procedure according to doctor's order. They help getting blood sample for baseline hormone tests and routine pre-treatment blood tests for both the wife and the husband. They also help to arrange husband's semen analysis test. When IVF begins, the patients will be prescribed medication by their doctors. IVF nurses will give detailed explanation of all the prescribed medication, introducing the patient with the type of drug they are going to use, the drug actions, the appropriate dosage, routes of administration, any side effects may caused by the drug, and also the storage method. The nurse will teach them how to administer their drugs, encourage them to do it by themselves, and make them feel confident to do it. Follow-up consultation with relevant hormonal blood tests are also arranged by the nurse. In some countries or clinics, IVF nurse will assist or even perform ultrasound scan. They count the number and measure the size of each individual follicle, assess the thickness of the endometrial lining, and to see if there is any condition affecting proceeding of the treatment. They then record the ultrasound reading for IVF specialists to review, to adjust the medication, and to plan the next treatment step. IVF nurses allow patients space to express what they feel and worry, as sometimes they may keep their treatment private from their families and friends. When moving to the egg retrieval phase, IVF nurses assist doctor for egg collection. They are responsible for preparing the procedure room and equipment, making sure the operation will be carried out smoothly. As the operation will be done under sedation or anesthesia, the nurse have to help administration of sedative or assist anesthetist to perform anesthesia. They need to monitor and document patients' vital signs throughout the operation. After the egg collection, IVF nurses assess patients' condition when they recover from sedation or anesthesia. They provide comprehensive post-operative care, like keep on monitoring the vital signs, observing level of perivaginal bleeding, assessing the patient's pain score, and looking after the patient to see if there are any abnormal conditions. Before the patient go back home, the nurses will provide them with post-operative instructions, including education on observing any vaginal bleeding, any sign of infection, and any sign of ovarian hyperstimulation syndrome. And they will remind the patient about the emergency contact method in case the patients need assistance when the clinic is closed. Before embryo transfer, IVF nurse help to update patient about their embryo condition, the number of embryo they finally get, or how many embryo can be frozen and stored. They continue to maintain sterility of equipment and tools during the procedure. Although the transfer procedure is painless, patient may still feel nervous and anxious. IVF nurses are there to calm the patient down and to ensure patient not only physically but also emotionally ready. After the transfer, nurses will then arrange the day for patient to have pregnancy test and remind patient to use luteal phase support medication if there is any. IVF nurse help to conduct urine tests or blood tests for the treatment outcome. No matter what the result is, nurses provide ongoing educational, emotional, and psychological support to patients. If the treatment failed, IVF nurse will counsel patients, help them to cope with the negative results, poor treatment outcome, or subsequent miscarriage. The nurse may also navigate patients with options for third-party reproduction, like egg and sperm donation, and even surrogacy. IVF nurse as an educational role, they have the responsibility on providing information counseling to patients. Apart from providing information which is relevant and accurate, it also needs to be timely, easy for patient to absorb, and evidence-based. Another point have to be mentioned to patients is that there are no guarantee that fertility treatment must work or they must be able to get pregnant. The nurse is accountable for ensuring all the messages and information delivered are well received and understood by patients. In all clinical settings, communication between team members is of paramount importance. IVF nurses act as the main interface between patient and the whole clinical team. They ensure all forms of communication, both written and verbal, are recorded accurately. To minimize communication error, some IVF clinics operate primary nursing care system. The primary nurse coordinates all aspects of patient's care in discussion with physician and relay the message between all parties. IVF nurses have to be aware of using realistic and honest language to manage patients' expectation, avoiding giving them false hope and any expectation which is unlikely to be satisfied. IVF nurse has the role to discuss any possible risk to patients, as no medical treatment is entirely free of risk, and certainly including IVF. IVF nurses need to make patients aware of this fact. The potential risks related to medication, for example, drug sensitivity and drug allergy, and ovarian hyperstimulation syndrome. They also have to discuss surgical risk. Although the risk is relatively low, patients still need to be informed about possible complications like intra- and post-operational bleeding and infection. Even after the patient gets pregnant, they still need to know the pregnancy risk. Many couples are not aware of these risks, which include multiple pregnancy, ectopic pregnancy, miscarriage, preeclampsia, gestational diabetes, fetal abnormality, and any risk related to the labor process. Role on psychological aspect. Patients having IVF treatment may have huge stress and emotional challenge. Patients may receive disappointing news along the way. For example, the ovaries did not respond to medication as hoped. The number of eggs finally get may be less than expected, and the egg may not grow to normal embryo. IVF nurse is the person the patient meets the most, and they may identify and recognize any potential needs for counseling and psychological services. The nurse leads educational conversation with them in order to be able to refer them to correct counseling service. IVF nurses help to enhance patient experience by providing emotional support, always being there and welcome to answer their questions and allay their fears. Nurse role on medical legal aspect. For patient confidentiality, nurses have the moral and legal obligation to handle patients' health information privately and not to disclose patients' information improperly. For informed consent, they manage the consent process by fully explanation of the procedure, risk, and actual chance of success. For the welfare of child, nurse is bound to consider the welfare of any child that may be born as a result of IVF. For example, considering the patient's commitment to having and bringing up a child, their likely future ability to look after and provide a child's needs, and the ability to provide a stable and supportive environment for the child. IVF nurse skills. IVF nurse should have sufficient medical knowledge and strong understanding of the female and male reproductive system and how it functions, knowing the mechanism and effects of hormone actions, pharmacology of commonly used medication, as well as the ability of interpretation of laboratory results. This knowledge should be based on evidence from clinical studies by using valid and reliable methods. The knowledge helps the nurse explain treatment option and procedure to the patients clearly. IVF nurse must have good communication skills and able to communicate well with patients in a clear and understandable way. They need to explain medical procedure and treatment in a way that is easy to understand and need to communicate with other medical team members to ensure patients receive the care they need. Types of communication include verbal, nonverbal, written and visual communication. To improve communication skills, IVF nurse needs to listen actively, sharing feedback, trying not to make assumptions, and able to ask questions appropriately. Empathy is the ability to understand and share another person's feeling. As an IVF nurse, they may work with patients who are experiencing fertility issues for the first time, or who have been trying to conceive for many years. Being empathetic can help the nurse building connection with the patients by understanding what they are thinking and feeling. The nurse can respond appropriately and help them feel more comfortable during their treatment. IVF nurses always work with different patients at a time, and they need to work with multi-professional team, so it is important for them to be able to organize time and task. Good organizational skill allow IVF nurse use resources effectively and efficiently, and also accomplish tasks successfully. Organizational skill should include good time management, ability to prioritize and planning, critical thinking and decision-making skills, and always be attentive to details. IVF nurses also keep themselves technologically up to date in order to check patient information, monitor treatment progress, and perform research. During the COVID-19 pandemic, more and more healthcare providers use technology to communicate with patients and other medical professionals, like using teleconsultation and video conferencing. They may also use technology to provide patient education, for example, pre-recording videos on self-injection technique, so that patients can revise whenever they need. In conclusion, patients are often emotionally exhausted by the time they reach the fertility clinic. IVF nurses play an important role in guiding and accompanying them in the whole IVF process by providing care to them and empathize their needs. IVF nurses are well versed in reproductive technology, having strong communication and listening skills, and being understanding and compassionate. They make sure patients feel relaxed and comfortable before starting IVF treatment, and they aim to make patients feel at ease and well supported from the beginning till the end of the IVF journey. That is the end of my sharing. Thank you.
Hello everyone, my name is Crystal. I'm nursing officer from Hong Kong Union Reproductive Medicine Center. Today, I will talk about the role of IVF nurses at post-IVF stage, the related psychological support and counseling. First of all, I will briefly introduce the role and responsibility of fertility nurses nowadays. Secondly, some possible post-IVF stresses at different stages will be discussed. Thirdly, I will suggest some tips and strategies to help support your client along the way, and 12 valuable communication skills will be also discussed. Finally, I will share how we provide post-IVF support service to our clients in our center. Now, I will briefly introduce the role and responsibility of fertility nurses. Fertility nursing offers a diverse and challenging working environment. The work of a fertility nurse is varied and takes in many disciplines and skills. The role is societal in nature and is flexible as the field of reproductive technology is very fast evolving. In the early days of IVF, the fertility nurse's role was very similar to other traditional nursing scenarios. It involved ambulatory outpatients, clinic management, supervision of patients, and data collection. As such, it was considered somewhat of a secondary role as compared to the primary role of the physician. However, the explosive increase in requirements for fertility treatments that took place in the 1980s created an increased demand on both physician and nursing resources. This necessitates a more team-oriented approach to the workplace and a consequent opportunity to re-evaluate the role of the nurses. Nowadays, depending on the clinic, a fertility nurse can be expected to be involved in all kinds of aspects of the IVF team scope of practice. This now includes theater work, coordinating team meetings, participating in decision-making, performing procedures, providing patient education, being a source of emotional support for patients. The key things here is the focus on teamwork with nurses, clinicians, administrations, management, and other healthcare providers. Through collaboration, the patient's experience and care are seamless. The fertility nurse is involved in all stages of the treatment cycle. There are vast roles played by the fertility nurse. For example, having an appointment consultation with couples, carrying out phlebotomy procedure, the fertility nurse needs to ensure that it is done in a comfortable manner, clean environment, and careful technique. Mentally preparing clients for semen analysis, provide information counseling, help your client to understand each step and process of the IVF journey, ensure counseling support for couples, to provide regular telephone call follow-ups or messages and email as means of follow-up on each client. Introducing client to their prescribed medication. This would entail a detailed explanation of all prescribed drugs, such as drug action, dosage, side effect, how to administer, and storage method. We should demonstrate on how to administer these drugs one by one. Assisting in transvaginal scans. We should provide emotional and physical support as some scans may come with some level of discomfort. We also need to assist in egg retrieval, provide emotional for couples with negative outcomes. Sometimes our client just needs someone to simply there, not to fix anything or do anything, but just let them know we are support and care about them. We can provide hands to hold and ear to listen, a heart that understands, and shoulders to lean on. Now let's move on to some sources of possible IVF stresses. There are main 4 stresses confirmed. Firstly is from family or Chinese culture. Meniscus said there are 3 things which are unfailingly and to have no posterity in the greatest of them. Once get married, in Chinese culture, the couples have the obligation to carrying out succession role. That means they should have a son to carrying on the family name. Failure to conceive naturally and failure to achieve the role of parenthood will also affect their personal image. Couple may be stressed about their peer friends who have become parents. The experience of infertility and its treatments is also highly stressful and can interfere with many aspects of life, including work, family, and relationships. Research showed that both men and women experience higher level of anxiety and depression during IVF compared to the general population. There are numerous internet information which will also induce different level of stress to the couples, as they may compare their situation or condition with the information from internet. Here are some examples from Facebook IVF groups. There are numerous information from internet. Patients may become anxious when they find their condition may be different from the situation from the internet mentioned. Now we move on to talk about the common post-IVF stresses. The procedure may be stressful due to the possibility of life-threatening excessive hyperstimulation syndrome of the ovary and uncertainty regarding embryo transfer procedure. Furthermore, a patient's hopes for a good outcome can exacerbate feeling of anxiety, thereby potentially resulting in depression if such an outcome is not achieved. When a patient expects a positive outcome, their anxiety can escalate and they may become depressed. Any of these stresses can therefore significantly impact the psychological well-being of otherwise normal patients, possibly overwhelming those already burdened by pre-existing psychological difficulties associated with their infertility. For post-IVF stresses, I divide it into 5 stages and will explain it one by one. The first one is after egg retrieval. On the day of egg retrieval, women can be very concerned about the egg retrieval procedure, and once the procedure is over, they will worry about the number and the quality of egg retrieved. Men also worried about sperm quality on this day, as it can be ultimately affect the quality of the embryo. Clients may also be concerned about postoperative discomfort, such as bloating and the effects of ovarian hyperstimulation syndrome. During the embryo culture stage, couples also struggle with the number of the embryos formed and the quality of the embryos. Then I will talk about the second and third stage together, which is before and post embryo transfer. Before embryo transfer, couple may worry about how is the transfer procedure and the embryo development after thawing. They may also have problems with the number of embryos to be transferred and fear about multiple pregnancies. At post-embryo transfer, the 10 to 14-day waiting period between embryo transfer and pregnancy test is considered by many to be the hardest part of the cycle. It is a time when the couple hopes are high, and so they are fears. After weeks of daily injections, doctor's visit and procedures, the wait can feel excruciating. Many couples describe the feeling is like an emotional roller coaster during this phase of treatment. In addition to the emotional turmoil at this stage of treatment, many couples are unwilling or unable to participate in regular stress relief activities. Some people may worry about their lifestyle choices during pregnancy and how they may affect the pregnancy outcome. Some minor issues, such as medication use, as a nurse, we should also need to aware how to educate and support our clients. The fourth stage is when the patient knows their beta HCG result is negative. Getting news when the patient knows that she is not pregnant can be devastating. It is very common for women and couples to feel a deep sense of bereavement when the treatment is unsuccessful. It is very common to feel out of control during treatment because of emotional turmoil, physical challenges, and the mental strain of trying to get pregnant. Around failure, people may feel hopeless and helpless. Here are some patients' expressions. When my cycle failed, I was heartbroken. It really felt like I suffered from bereavement. I lost a child, I have positively pictured in my mind through each stage of the process. The final stage is early pregnancy stage. At early pregnancy stage, women whose pregnancy is from IVF will be more vulnerable. Research also indicates that anxiety scores were slightly higher among IVF compared to non-IVF pregnant women. Some of them had additional anxiety, using such words as fear, worry, anxiety, and stress. They may continue to think about the health of their baby even when they are sleeping. Several women in the research indicate that they are anxious about the health of the baby, especially the upcoming genetic testing. While stress is an inevitable part of IVF, there are strategies available to help you support your client along the way. Here are some tips to help your client better cope with the stress of IVF. The first one is take it step by step. The IVF process can be overwhelming. It starts with the many baseline appointments, coverage discussions, and treatment decisions that need to be made before starting a cycle, and each requires different preparation. There are numerous medication preparation steps need to memorize. Rather than being overwhelmed by the number of steps required from start to finish, it is important to tackle the checklist item by item. Here are our center's IVF information checklist and education video guide to assist our client to well prepare for the IVF treatment. The second one is prioritize self-care. In most cases, normal life continues during the IVF cycle, and coping with the IVF demands and other stresses can be difficult. Studies show that stress does not affect IVF success. However, health is a great reason to prioritize self-care. It is especially important to make space to be kind to yourself whenever possible before, during, and after your client's IVF cycle. What kind of activities do they like to do? What is it that brings them joy? What activities make them feel loved and valued? Encourage your client to prioritize time for these activities as much as possible. The third one is help your client to train their stress tolerance. IVF is uncertain at every step, making it difficult to feel comfortable. There are techniques that can help your client to accept the discomfort that comes with losing control and unpredictability. During with pain can be difficult, but it is an important exercise that can increase the client's overall pain tolerance in the future. The client can find specific strategies for stress resilience, for example, practicing breathing exercise, mindfulness, and singing bowl. If needed, find a therapist who provide evidence-based care for those with fertility issues to your client, as they are the best experts to help your client with their fertility problem. It is important to find someone trained in cognitive behavioral therapy and evidence-based trauma intervention to help your client with special needs. The fifth one is suggest your client to find their best social supports, preferably other people who understand the stress of IVF. IVF is personal and can feel like a lonely journey. It may be helpful to build a small but reliable and helpful network of people who have gone through the IVF process themselves. While their treatment protocols and experience may differ from your clients, suggest your clients as having a couple of people who are willing to listen to how you are feeling and share their perspective can be really helpful. The final one is be careful of IVF groups on social media. Your client may be tempted to join a social media group to seek support. In some cases, these groups may be useful. In other cases, they create fear with stories about pregnancy announcements. It can also be a source of misinformation about infertility. For example, some members of an IVF group may suggest eating pineapple seeds to increase the chance of a successful embryo transfer. Although this behavior won't hurt your client, but they are unlikely to affect the chance of success. These groups can lead to a social comparisons that aren't always helpful. Every treatment plan is unique and results vary widely. Beware of how engaging in these posts make your clients feel and decide if they are helpful or harmful. Navigating the IVF process is stressful enough. As nurse, we should know to recognize our client is under stress. We should try to help them in planning in the upcoming treatment. For example, to suggest them to plan treatment during their longer leave to avoid work conflict. We can provide some instant messaging support for our client in case they need instant help. There are 12 valuable communication skills we can apply when communicate with our clients at all stages. Good communication is vital to all stages of counseling. Skills should ideally include active listening skills. Active listening involves paying close attention to what others are saying and asking clarifying questions to demonstrate interest and understanding. This facilitates effective communication while simultaneously allowing us to show respect and build relationship with our client. The second one is clarification. Clarification is an essential part of communication. It is all about structuring your thoughts logically and using the right words to communicate them as effectively as possible. The third and fourth one is reflection and effective questioning. Communication is a two-way street, and strong communicators are able to provide and accept feedback. Good feedback offers answers to questions and solutions to problems. The goal of feedback, including reflection and effective questioning, is improvement or betterment. Beyond that, to build rapport with the client, nurses must also be able to experience and show empathy rather than sympathy. Empathy involves a shared understanding of others' emotions, which is critical when it comes to communicating at work. If you understand how or what someone is feeling, you can assess how to best communicate with them and choose the right approach. See things from the client's perspective, have a genuine interest to others' well-being, use self-reflection to observe themselves and empathize with others, show accessibility and authenticity during counseling sessions. Be flexible in their views and thinking regarding differing values and multicultural issues. Be able to maintain a sense of humor. Be resilient and able to bounce back from difficult situations. Here's how we provide our clients with post-IVF support service at our center, which fall into three main categories. The first one is operational service, the second one is psychological support, and the third one is counseling service. In operational service, for those who need special care in the hospital during the post-IVF phase, we offer a protection plan for post-IVF treatment cases, as the financial stress in the cases of IVF is very high, so our hospital provides them with some financial compensation. At our hospital, we have early pregnancy clinic. We can care for those who have complications such as swelling, bleeding, and abdominal pain in the early stage of pregnancy. We also offer 24-hour emergency care to our clients. The second is psychological support. We offer all our clients post-IVF phone follow-up, including after egg retrieval and embryo transfer. We also provide a designated nurse and embryologist program to ensure patients' care at our center. We also have a designated embryologist to update couples about their embryo status. The third one is counseling service. If needed, we provide our client with early pregnancy counseling by nurses, doctors, and dietitians. We will also refer clients to professional counseling service for those who are feeling anxious or depressed during the IVF process. The photo shows our early pregnancy clinic. The environment is warm and comfort. The form on the left-hand side is our post-IVF complication coverage plan, and on the right-hand side is our guideline on how to phone follow up our client after IVF procedure. Let me introduce our teams to you. In the center is our professional clinicians. On the left-hand side are our nursing team, and on the right-hand side are our professional embryologists. We all work as a happy family. We enjoy working with each other, and it is very rewarding to have families reach their goals of having a baby, where communication of pregnancy outcomes must be handled with optimal care, consideration, and kindness can only be achieved through empathetic patient support. To conclude, in the presentation, I have briefly introduced the role of fertility nurse nowadays, which is different from past days. Most patients have already gone through a major emotional fertility journey before arriving at an IVF clinic. Our goal is to help them feel relaxed and comfortable before starting the IVF process. We can utilize the 12 valuable communication skills to build up the rapport with the clients so as to facilitate an effective counseling. We want them to be comfortable from the moment they walk in the door. Starting with general friendly check about how they are doing, how they are finding their injection, helps to make their experience a more personal one. It helps open the discussion to make the women comfortable to chat about anything that may be troubling them about their cycle. Sometimes women keep their treatment quite private from family and friends, so it allow them space to chat openly when they may otherwise have no one to talk about this, aside from their partner. We can get to know the women and their families well. On the other hand, nurses can also act as a medium to explain to clients how eggs, sperm, and embryos are managed in the IVF lab, as laboratory science and technology is complex, and the nurse's job is to translate it into a more understandable language so that the client can understand the IVF process. As IVF technology continues to evolve, knowing that we are providing next-generation technology for our IVF patients make our role as fertility nurses exciting and rewarding. That's the end of my presentation. Thank you.